Welcome to the Birth Lounge Podcast, an empowering space for expecting and new parents to hear candid conversations with experts, support your mental health, and learn the tips and tricks that thousands of parents have used to craft their ideal birth. We will answer all of your questions, the scary ones and the weird ones, to help calm your fears and feel confident going into your birth. I'm going to help you redefine what birth and motherhood looks like and how to embrace your journey. I've intentionally crafted a list of experts to help you navigate pregnancy, explore your birth options, and plan for postpartum so that it can be a time of soaking in your tiny human. We're going to go there on all the hard topics so that you can dive deep into finding your confidence and freeing yourself from fears around birth. With over 10 years of experience in family education and a master's degree in human development and family studies, I created this podcast as a way to share the resources parents need to make educated and informed decisions about their care in pregnancy and childbirth. This is a birth community driven by evidence-based information and research in hopes to help you explore your options, understand your rights, and know what choices you have along the way when it comes to birth and beyond. I'm your host, HeHe. Now let's get to the good stuff. Welcome to the show.
Thanks for having me, HeHe. I'm so excited.
Yeah, I'm very grateful for you sharing your story, even though I think the whole experience, you and I chatted before, it was traumatic. And so I hope that our listeners today walk away with a couple of things. I hope you understand that you don't necessarily need to know somebody in your immediate circle to know that this is real and this isn't in your head. HG is totally real and it happens. So find your people, find the people who have gone through this. Don't be afraid to advocate for yourself. So I'm very eager to hear your experience with advocating for yourself in our healthcare system when you did have such a real thing like HG. And then also, I think I'm very eager to hear how it impacted your birth story so that our listeners can understand how it's not just a one-time diagnosis. It is something that we need to be thinking of long-term in terms of our health and our pregnancy and our birth experience. I'm going to be quiet. Anna, thank you very much for coming on the show. Can you start us out with telling us, maybe let's start with your birth story. Let's start with your pregnancy and your birth story, and we'll break off into questions from there.
Okay. So I found out I was pregnant last year on March 4th, 2023. And I have a history of endometriosis and POTS and also cyclic vomiting. And I was actually told right after I had an endometriosis removal surgery in 2019 that I was probably going to have to do IVF, that getting pregnant would be very difficult. And I was really shocked that not only did I get pregnant easily, but that my pregnancy for the first couple of weeks was actually fairly symptomless. It seemed like everything was just kind of chugging along, and I didn't know how far along I was when I found out. Because my cycles were irregular, I was like, man, I could be like maybe 8 to 12 weeks pregnant. And if that's the case, like I may not even get sick at all. And I found out I was 4 weeks, and I was like, oh no, that means that maybe the worst of it is still like on the horizon for me. And right at 5.5 weeks, I started throwing up pretty intensely with a lot of nausea. And I call my provider, and at this point I haven't even been seen yet. And they're like, yeah, pregnant women throw up. That's normal. And so they're like, we'll just talk to you at your first appointment about your options. So I go to the doctor, and because I have POTS, I had been authorized by my cardiologist to be on an IV regimen of up to three times a week. And so I was sharing with the provider that this was like a pretty regular part of my routine for my POTS management. And they're like, oh, we're not going to authorize you to do that. And I was like, okay. So that right off the bat kind of freaked me out. And so I was like, if I start throwing up to where I need fluids, what am I supposed to do? And he's like, you need to go to the ER. And I live in Atlanta, and so you can throw a dart and hit a private IV clinic, and all they require is a doctor's note to be seen. And I was like, I actually used to work in an IV clinic, so I know that I just need a note. Is there any way that you could please give me a note to go get IV fluids at a private clinic? And he was like, we will not do that. So right off the bat, I was like, man, this is going to be a really interesting process. He prescribed me diclegis, which was the B6 and Unisim combination, and it did not touch it at all. So kept throwing up. And I obviously had a Zofran prescription from having cyclic vomiting and also with having POTS. And I knew the risks of taking Zofran and read the studies and was like, you know what, I think I'm just going to take one and just hope for the best. And Zofran wasn't touching it. And I was like, I've never had nausea and vomiting that Zofran hasn't helped. I don't understand this. Called my providers again, and they were like, here's Phenigrin. And I was like, okay. So they told me I could rotate Phenigrin and Zofran, and I did that, and it didn't help. I was throwing up the Phenigrin like immediately after I would take it. And they're like, well, take a suppository form. So I tried that with rotating that and Zofran, and nothing was working. So this continued up until I was 22 weeks pregnant and had lost at this point about 15 pounds. And when I hit 22 weeks pregnant, my husband walked in the bathroom and looked a little concerned. And I was like, what's wrong? And he's like, how long has your vomit looked like that? And I was like, I don't know, like maybe a couple of weeks. And he was like, okay, I just want to keep an eye on it. And he didn't tell me what it was, but I was actually vomiting blood and didn't realize that's what I was throwing up. So he kept an eye on it. And at 27 weeks, he walked in the bathroom and he's like, we need to go to the hospital. And I was throwing up straight, like as close to black as you can get while still being brown. That's what I was throwing up, just pure black stuff. And it was horrible. We go to L&D, and L&D was like, yeah, like sometimes pregnant women will throw up blood, can't really help you. And I was like, I've been calling and calling for weeks trying to get you guys to prescribe me something that will help. And they're like, have you tried Zofran? Have you tried They're just giving me the same drugs over and over. And I'm like, yes, I've tried all these things and nothing helped, nothing touched it. And at that point, when I hit 27 weeks, I was also having like really severe upper back pain in between my shoulder blades. And it wasn't just when I would throw up, it was all the time. But I had thrown up so much for so long with such intensity that I had hurt my back. And so that was going on. And so I went to L&D about 7 times before I delivered, begging them to do something and to help me. And every time it was, you're pregnant, it's clearly a GI issue for you at this point, but because you're pregnant, we can't help you. So the blood is either from bleeding ulcers or an esophageal tear, and we can't tell you which one. But I was like, what can you do to help me? And they're like, when you're not pregnant anymore and you're not throwing up anymore, it's going to go away. So I did a GI consult at this point, and the GI doctor was like, you're pregnant, I can't help you. And I was like, there's got to be something, right? There's got to be something that you can do. And so the OBs wouldn't help me because it was a GI issue, and GI wouldn't help me because I was pregnant. And I got caught in this really just bizarre cycle of no medical provider was able to give me answers. And I ended up going to a private clinic that didn't require an IV note to get fluids, and stuck that out. And then they gave me an IV note at a certain point. And at that point, I was like, this is great. But so much damage had been done up until getting that note in the 3rd trimester that the damage was done, basically. So they offered, at 36 weeks, I went into prodromal labor while sitting in L&D for this vomiting issue. I started having contractions that were like legitimate contractions. And they were like, has anybody talked to you about a Zofran pump? And I'm like, I'm 36 weeks pregnant. That would have been stellar to have when I was 12 weeks pregnant. But I'm at the finish line now. As I shared, the damage is done at this point. So I don't know what I'm really supposed to do. Up until the day I went into labor, I was throwing up anywhere from 5 to 15 times a day. And people were like, oh, it'll get better in the 3rd trimester. It didn't get better. It actually got worse. It was just, the whole pregnancy was a kind of a vomiting nightmare.
Oh, sorry for that. That feels terrible. I don't even have words to describe that conundrum that you described of OBs don't want to practice outside of their scope, but other providers don't want to touch a pregnant woman. And the person that actually pays the price is the patient, and they're the one who needs the help. They're like, help me, and nobody will help them. Wow, I have so many questions. I guess my first question is, did it ever cross your mind to change providers? Was that within your access? Did you ever think, gosh, I wonder if anybody could give me better care? Were you ever referred to a specialist? Your doctors never tried to bring on any additional support? Nothing.
So here's what's so crazy about that is I went back through my progress notes in the online portal after I delivered. And really, it wasn't until after I delivered that the severity of some of this set in of, I can't believe I just survived that. And one of the things that they told me in labor and delivery at 36 weeks was, we don't have anything in your chart about vomiting being this severe.
Oh my goodness, no.
The phone calls that I made all the time to the practice weren't listed. The progress notes often did, like one of the notes said, patient feeling better, nausea improved. And I was like, did they post someone else's notes in my chart? Because I did not say that. So it was almost like it was just never even acknowledged on their behalf. I did consider earlier in my pregnancy switching providers.
Hmm.
The hard part, I feel like, with being in Atlanta is you have access to so much medical care that I had a really hard time deciphering, okay, if I even switched, where do I start?
Hmm.
And so I actually found, again, after I was pregnant, the HeHe Foundation that's doing so much research on HG, and they've got these patient protocols and physician protocols. And part of what they have is a provider search where you can actually find providers where patients have said, hey, I've had success with them treating HG. But again, I didn't find that till after I had delivered. And so I already know the provider that I will be switching to if I ever have children in the future. But at the time, I didn't even know that resource existed. And so I didn't have any friends who had been as sick as I was. And my mom had HG when she was pregnant, but I was in her practice. So I was like, the only person I know who's ever had this bad, I'm already where they were. So I think I felt maybe just a little stuck and helpless in that even if I did switch, I don't know if anybody's really going to be able to solve the problem.
Yeah. Okay, you mentioned if I ever get pregnant again, did this change your feeling about pregnancy and growing your family and any of that? Did it make you question, like, gosh, do I want to do this again?
100%. Up until the moment that I had my daughter, I was like, I will never do this again. I'm an only child. My mom is an only child. So only children in my family are not abnormal. And so when I was pregnant and going through all of this, I was like, I will never, ever do this again. And since having my daughter, I understand now when people are like, you love them so much that you almost forget. I understand that now. And so I think to get my daughter again, I would do it in a heartbeat and I don't regret it. I would just do a whole lot of things very differently from the get-go.
I'm like, what? What are those things? What would you have done differently if you could go back and tell yourself, like, hey, you're about to go through this really hard thing. Here are the things that can make it easier.
I would have switched providers. And now that I have the HeHe Foundation's resources on finding providers that can help manage this, I think I feel a lot more confident in doing that again, knowing that other people have had success with these providers. I would have fought tooth and nail for an IV note. And I fought as hard as I felt like I could at the time. But I think looking back, you always see things that you could have done differently. And I think that I would have taken cardiology recommendations. I would have been more clear about my cyclic vomiting history and how important it is to have IV fluids on a consistent basis. So I think I would have switched providers and I think I would have fought a lot harder for the IV note. I think I also would have pushed harder for a Zofran pump to begin with. I didn't even know Zofran pumps existed. So again, that was something I learned after the fact when that provider mentioned it at my 36-week L&D visit. But yeah, I think I would do those three things differently from the get-go.
Yeah. What other things? I think we can all acknowledge that the research and data around HG is pretty shallow, which is so surprising because it does impact a fair amount of people. And obviously, we can see the severity that it can get to. It's baffling that we don't have the research. But What research did you find along your way that I think surprised you the most? Or like the pump, what were the moments where you were like, gosh, it would have been nice to know this, but I found out too late?
Yeah, I will just keep singing the Her Foundation's praises. I was
Mhm.
just deep diving their patient protocol, and they have like very specific IV bag formulas on there. And they also have a whole workup of things that you can do prior to pregnancy that will can basically just get your body in the best shape possible. I got all of my vitamins through IVs before, and largely that was because every time I took them, I didn't feel well in a GI sense. And so I was like, I don't want to take anything that's going to make it worse. But there's some vitamins that I couldn't get in an IV that were on this recommendation. And so I think being really intentional with getting my body in as healthy shape as possible. Even like they talk a lot about exercise beforehand. Like, obviously, I did not feel like exercising when I was vomiting 10 plus times a day. But I think that's something that beforehand, just seeing the importance of exercising, taking just a certain vitamin regimen, and then also like making sure that from a hydration standpoint, you're getting yourself off to a good start before it gets so bad.
Yeah. Okay, you talked about advocating for yourself. I want to know what these conversations looked like with your provider. What were the actual things that they were telling you? And maybe you've said it. Maybe it really was just like, all right, this is normal for pregnancy. But what were some of the things that you think people should be prepared for in terms of maybe their provider doesn't know that much about HG or doesn't truly believe it's real or doesn't, for some reason, isn't diagnosing them with something that they need? And then I think, what would you help these people say? You've already been through it once. What are the phrases that you learned were really helpful, and what will you use next time in a pregnancy if you have HG?
Yeah. So to your first question, the amount of times that somebody at this practice said to me, pregnant women throw up, that's normal, was dumbfounding to me.
Mm-hmm.
I think part of my problem was compared to a lot of women with HG, I didn't lose as much weight as you might think. I know a lot of pregnant women, when they have nausea, they won't eat. I didn't do that. I still ate, but I just threw everything up all the time. I think to a certain extent, my body kept more of that nutrients than I realized. And so I did lose weight, but I did start to gain some weight. So I think that didn't necessarily help my case when I was talking to them about how severe the vomiting was. However, 5 days postpartum, I was 38 pounds lighter. So I lost every ounce of my pregnancy weight by the time I was 5 days postpartum. And I was talking to one of my friends who's a nurse, and she was like, Anna, you need to call them and tell them that you've lost that much weight that fast. That's not normal. So again, that was a telling sign, but it was just too late. So I think my weight played a huge role into the fact that when they would look at me, I didn't necessarily fit the exact mold of what they were looking for, but they would just consistently tell me pregnant women throw up, that's normal. And it just felt every time I asked a question, it was dismissal with a hint of you don't know what you're talking about. And I would mention, I remember that very first, it was at my confirmation appointment when I was outlining my medical history. And this was a doctor I had never seen before in this practice. And it was just a blatant, no, we will not do that. There was no like productive alternative offered. It was just, no, we won't do that. Pregnant women throw up, that's normal. And then when I would call and say, hey, this medication is not working, have you tried X? Yes, I've tried chewing ginger. And it almost was just like, I don't think that I didn't felt like I was really being heard. I
Yeah.
felt like they were just throwing the typical try ginger related things or take diclegis or all of the baseline nausea options. But when I was like, no, like, you don't understand, this is out of hand, it was like it was not clicking for them what I was really trying to say.
Man, that's really too bad. Just look at how much like physical damage, emotional damage, birth trauma, pregnancy trauma that could have been avoided had they been able to understand what you were truly advocating for. No, this is my throat is bloody. This is clearly not normal, right? I am having some really abnormal signs. One of my favorite things for people listening, if you're like, oh my gosh, this is me, I need to know how to advocate for myself. I've got two phrases that I really like. And one is simply saying, I understand this seems normal to you, but it's impacting my quality of life. And that usually gets your doctor to open up a little bit more discussion, which I hate, Anna, that you did not get. I hate that your doctor just steamrolled you. They literally just brick walled. No, we're not going to do this. There was no discussion, no conversation, no check in even with you. The second thing I love is you can say, okay, if this is normal, what would you be looking for it to be concerning to you? And that way you know what your doctor is looking for. But I think your story highlights that you really can advocate until you're blue in the face, until you're literally throwing up blood. And sometimes your efforts are just they're ignored, right? There's no attention paid to them. You had mentioned like some of the damage that had happened from throwing up. And I just wanted to make sure that people realize too that it doesn't always have to be this bad to be causing problems. So we really want to avoid vomiting in pregnancy, and albeit be a little normal, sure, nausea and morning sickness is normal for a temporary amount of time, and it should not actually be impacting your quality of life so severely. But yes, weight loss, which you had mentioned, but dehydration and electrolyte imbalances and damage to your esophagus, which you had mentioned, esophageal tears, your throat. You'll be depleted of nutrients and vitamins and minerals that your body needs and actually keeps stores of for when we're pregnant so that your body can dig in these stores. And I think that you make a good point that just because you're not losing a certain amount of weight doesn't mean that you're not having pretty severe problems. Like weight loss is one piece of this puzzle, but making sure that you're looking at the whole body and the whole person and the whole dyad of mom and baby is super important too. Oh man, I am like so speechless, I think, hearing how bad things were. And there were so many opportunities, missed opportunities to get you the care that you needed. And that's very indicative of our healthcare system, I think, right now, current day, what we have in the US right now. Hopefully it gets better soon, though.
That's my hope for sure.
Yeah. Okay. Gosh, I'm so appreciative of you sharing your story with everybody. I know this wasn't necessarily a happy story, but I think it is one that, like you had mentioned in the beginning, if you're going through it, chances are you might not know somebody else who's going through it as well. So it can not only feel really terrible physically, emotionally, but also very isolating in terms of, oh my gosh, is my body broken? Is something wrong with me? Is this normal? I don't know anybody else that has that. Were there any resources that were super helpful to you other than the Her Foundation that maybe connected you with other moms? Have you since found Facebook groups? Are there any resources that you can share with people who are listening that have been struggling with this or has a diagnosis of HG and is looking for that support?
Yeah, there's a Facebook group that was I found that was just with other moms experiencing HG, and I did join that. And then I was in one for POTS as well that was really helpful. I found that it's just shockingly common for people with POTS to have
Wow.
HG. And so that was really helpful just to merge those two diagnoses in one and find people that were going through it. And I learned a lot. I know Facebook groups can get a bad reputation, but I found them to be really helpful. And I learned a lot just from hearing other people's experiences and then being able to be like, hey, this is what I've tried. And it didn't necessarily work for me, but it might work for you. So Facebook groups were a huge resource. I think too, I think Googling, I feel like there were times when I Googled things that were like, that's ridiculous. But I would Google something else in relation to what I found. Like, for example, a lot of the things that I read were like, eat carbs. Eating carbs was the most unhelpful thing that I ever heard. But what that did was it actually got me to do more research into, okay, what should a diet be looking like? And then what I found was that high protein in the morning can really help. And so what that actually ended up doing was I was able to keep a little bit of my breakfast down. So I found that the nausea actually was and the vomiting was way worse in the evening. So what I would try to do is get more protein in the morning. So that way I was getting at least a little bit of nutritional value during the day. Do I think that Google solves all of our problems? No. But I think when I Googled something and I was like, but I'm already doing that and that's not making sense, it made me dig deeper into just the concept of nutrition and what I can be doing, that maybe I've already tried this and it didn't work.
Yeah. Don't be afraid to do your own research, right? And you don't have to be a scientist. All you're doing is looking for connections and possibilities, and then you can go out and have your team help you evaluate that, whether that's your partner or your doctor, your midwife or your doula or your naturopath or whoever you're working with can help you go through the information that you have found and see if it is a good and viable option for you.
Definitely.
Yeah. Okay, so to wrap up, does that mean that you never found anything that worked for your nausea and vomiting? You literally went through pregnancy and never found anything that was super helpful.
I never found anything that fixed it. And the crazy thing, the only drug that I would say that was even a little bit helpful was I started taking Protonics as well, which is an acid blocker, and that helped a little bit. So I found that if I took promethazine with the Zofran and interchanged them and took the Protonics, and I took the Protonics in the morning and at night, and it was a really high dose, that was the best I felt. Didn't take it away by any means, but it got me steady. Now, what I will say is postpartum, if I do not take the Protonics, I will throw up still. So even postpartum, I've thrown up 4 times. And if I don't take that acid blocker, then I'm sick. So even that is super interesting because people are like, oh my gosh, you're going to deliver and everything is going to be fine. But I think what was failed to take into consideration is when that much damage gets done for so long, your body doesn't just magically bounce back once you've delivered. So now I'm 12 weeks postpartum as of yesterday.
Congrats.
Thank you. I am still trying to figure out what it looks like to eat correctly, cut down on an inflammation because my gut is so messed up, take the acid blocker, which seems to help me not throw up. And I still take Zofran really consistently. It's going to be a journey of getting my body back to a healthy state because so much damage got done during the pregnancy.
Yeah. You take that acid blocker every day.
I take it morning and night.
You take it twice a day. Do you think that's a forever thing, or are you hoping for it to be temporary, or what do you know about that?
I'm hoping for it to be temporary. One of the things that I discovered right before I got pregnant, and this was horrible, was that I had a pretty severe gluten intolerance. I would eat it and I would bloat up to look 8 months pregnant, and I was not pregnant. My bloating was insane. I went up 4 pant sizes in 4 months. Like, it was crazy. And so that was right before I got pregnant. And then I got pregnant and I felt so bad that I would just eat whatever I felt like I could stomach at the time. So I ate quite a bit of gluten when I was pregnant. And I was like, I'm going to get fat anyway. Might as well eat the gluten and enjoy it. And so when I delivered, I tried to eat gluten again and I had like cripplingly bad pain. And so I like right before Christmas, so that was like about a month after I delivered, I was like, I am not eating gluten anymore. When I didn't eat gluten before my pregnancy, I didn't have to take the acid blocker because I already took an acid medication before I was pregnant and it helped. But now if I don't eat gluten, I find that it's less irritating. And I think it really just boils down to inflammation. I think my system is just super inflamed and that acid blocker just takes the edge off, honestly. Yeah. So my hope is that I will not have to be on that long term, because I was told, it was funny, one of the OBs was like, you can't be on this for longer than 3 months at a time. And then the GI doctor was like, no, it's totally fine. So even then I was getting like conflicting information from the OBs of don't take it. And then the GI doctors, no, it's totally fine. And you're like,
who do I listen to?
Who do I listen to? What do I do? But I chose to take it because I found that if I didn't take it, the vomiting was worse.
Yeah, for sure. Okay, so what's your opinion on the new gene, the new GDF15 gene that is supposedly linked to HG and morning sickness and all of this? Are you going to get tested? Do you think people should get tested? Do you think we should be testing everybody? Do you think it's true? What's your opinion on this?
I'm cautiously optimistic.
Okay.
That research came out a week after I delivered.
Oh my goodness.
And I was like, dang, ain't that convenient? I'm cautiously optimistic. I will get tested. I think that if you feel, this is my whole thing, is that I feel like if women find that something is off, and you're like, I know that this level of vomiting is not normal, I would say get tested. I think that we know our bodies better than any provider ever will. And we know when something is not right. And I would definitely say if you have any concerns or medical history of GI stuff, just go ahead and get tested and try to get ahead of it as much as possible. If I had known that research before I was pregnant, I would have 100% gotten tested before I found out, just so that way I could try to do whatever I could to get ahead of it.
Yeah. 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 And even if you're already pregnant, you're like, wow, this cannot be right. You can request it then. Oh my goodness, Anna, this has been, dare I say, fun talking about such a not great topic, but it has been amazing, honestly, to chat with you and to hear your story. And I know I've already said this, but I am very grateful because, again, this can feel really terrible mentally, emotionally, physically, but on top of that, very isolating, which makes so thank you so much for sharing your experience with us. If people wanted to connect with you or hear more about your story, or maybe they have a very similar story and they just want to chat it out with you, where can they connect with you?
Yeah, so my Instagram handle is AK Cosentino, and my last name is spelled funky. It's Cosentino. So AK and then Cosentino at the end.
Amazing. I love that. All right, you guys, I hope you are walking away with some really powerful information to help you understand what's normal, what's really not normal when it comes to morning sickness and vomiting in pregnancy, what you can do in order to advocate for yourself, and where to turn if your provider maybe is not listening to you as well as you had hoped. All right, you guys, I will see you in the next episode. Until then, go find us both on Instagram. I'm at Tranquility by HeHe and also at the Period Birth Period Lounge. And we'll connect there. All right, you guys, bye. Thank you so much for tuning in today. I truly do value this community and I love hanging out with you. You deserve to have a birth that you love with a provider that values your autonomy and respects informed consent. It's an honor to be your go-to gal when it comes to preparing for your baby. If you found today's episode helpful, share it with a friend. Share it with someone who could use evidence-based information to help them have an informed and confident birth. I'd love to hear what you have to say and read your sweet words. By leaving us a review, you are helping other expectant mamas and their families find the podcast so that we can reduce birth trauma and improve maternity care in the U.S. one birth at a time. If you're interested in joining the Birth Lounge, go to thebirthlounge.com. If you want to connect with me on socials, you can find me at Tranquility by HeHe on all platforms. Until next time, stay educated, stay supported, stay confident. Bye.